It's Monday, June 1st, 7:30 a.m. I'm at Cleveland Clinic at the ENT for an appointment. Um, I've had, I guess, profound hearing loss.
Which ear?
Both ears.
Profound?
Yeah. It's like almost like hearing underwater.
All right, so you feel like you're in a barrel?
Yeah.
Okay. How long has it been going on?
Since February, I guess.
Okay. So do you feel like your ears are full, like they're plugged?
Yeah, I guess
Both of them?
plugged. Yeah.
Okay. Did you have a cold or anything?
I had long COVID. You know what that is? That's
Yeah.
when you have the
Mm-hmm.
flu-like symptoms resolve.
When did that start?
February.
So everything's February?
Yeah.
Okay. Do you have any pain in your ears?
Yes, it was pressure.
Pressure right now too?
Yeah.
Both ears?
Not as much as it was in February. It was
Okay.
really bad.
Really bad.
I had like 80% loss, I guess, in both ears.
Do you
And now
have
it's
pain? Or
not
drainage?
necessarily pain,
Okay.
no.
No drainage? Okay.
Some slight liquid does come out.
Both ears?
Yeah.
You have any ringing in your ears or noises?
No.
No. Okay. Any dizziness from this?
There was for the whole month of February, especially in the mornings.
No, it's gone now.
So attribute that to the long COVID. Yeah.
Okay, it's gone now?
Yeah.
Okay. Any
No
history of noise
dizziness.
exposure, like guns, factory work?
There's lots of creaks and groans, not normal creaks and groans, not normal impact sounds. They're like very loud creaks and groans from the pacing of the neighbors upstairs.
Oh, okay.
And I'll get right to the point. I believe this is caused by the sewer gas coming into the home, namely the hydrogen sulfide in the sewer gas. I believe that's what's causing it.
Okay.
It's long-term exposure for like a year or so, I guess. I believe that's what's doing it.
So no guns?
No,
No
no,
factory work? No
none of that
hunting?
heavy, no
Nothing like that?
jackhammering, nothing like that. No. But you can compare the, yes, actually, I like to change my, because I already said yes, the creaking and groaning. It's comparable to a jackhammer going off above my head.
Okay. How about ear infections and ear surgeries?
No, I don't believe it's an infection. Of course, I
Okay.
could be wrong.
All right, don't talk and swallow just for like 4 seconds. This is just checking to see if you have fluid behind your eardrums, since you're telling me you feel full.
Mhm.
Looks like you have fluid behind your eardrum. Do you have any cold-like symptoms right now?
No,
No? Okay. Any history of chemo, radiation, or concussions?
no.
No? Okay. I'm going to do this side one more time. So it looks like you've got a lot of negative pressure in your ears.
Okay.
That's the problem is the eustachian tube. Like when you go up an elevator and your ears pop.
I assume it might be
Yeah, that's what's
something
going on.
to
Eustachian
do.
tube dysfunction, and that's typically
Might-
due from the weather changing.
Maybe the eustachian tube not draining properly.
Correct. And that's
Correct,
usually
yeah.
from the barometric pressure outside
Okay.
changing.
Okay.
Here's your little button. I want you to push it every time you hear the beep, even if it's tiny, okay?
Okay.
This is a sensitive diagnostical test, so we can treat you properly.
Mhm.
Which ear's better? Can you tell?
The right one is slightly better.
Okay.
Yeah, I can hear you. It's slight. Oh, okay. No, I can barely hear you. Okay. Yeah. Okay. Playground. I think it's daybreak. Northwest. Uh, it sounds like mushroom, but it was not very clear. Doormat. I didn't get that. I my word. Sounds like padlock, but it was very muffled. I heard something, but I had nothing. I can't make. I heard something when I'm talking. I'm hearing it, but no. It's just like I'm just hearing muffles. Something maybe oatmeal. It's very okay. Okay. Still going? She said I'm hearing better, much better than I'm trying, so it seems. I'm having anxiety now. I'm having really bad anxiety right now. I think we should conclude this test. I think we should be done here. And I don't know if she can hear me. I'm not hearing any tones. She told me it seems like I'm feigning. Yeah,
What's
it
wrong?
seems like I'm feigning. I heard you say that.
No, I didn't say that.
I'm having anxiety now. I'm sweating out of my chest. Are we done with this test?
No, we're not. We just started it.
You said we're going to have to do the portion of the test again.
We are. The beeps
Okay.
we are.
Are we
it
doing
didn't-
that?
Yeah, we can.
Well,
we
we're
can.
not. Okay, I'm having anxiety bad now.
Would you like to stop? Because if you're seeing Dr. Tim and he needs the results.
Okay,
it's
let's
up to you.
proceed and get this over with. I'm not very comfortable now. I don't like anyone calling me a liar. I can't record what she's saying to me through my headphones, through some headphones, telling me I got to do the clicking tone portion of the test again because she feels that I'm hearing better than the results that I'm giving. Here, I'm just going to sit here and push this fucking button over and over again until she starts the test while I'm sitting here waiting. I feel very insulted right now.
Are we done? Did you want to keep doing the testing?
I can't hear you at all with those on.
Did you want to keep doing the test?
I'm waiting for you to conduct the test.
But you couldn't hear the beeps when you're talking. I need you not to talk so you can hear the beeps.
Okay, I'd rather just see the doctor and be done
Okay,
with
he
this
won't be able to
test.
diagnose you without the test.
I'll tell them there was a problem.
Okay.
The problem was you. You should keep your mouth clean. You should not say things like that to your patients.
What did I say, Teddy?
It's not on the record. I didn't record it. It doesn't
Come
matter.
on out, Teddy.
You made me very nervous by saying that. I want to see the doctor immediately.
All right, well, you'll have to wait for your appointment, Teddy. Come on
I was
out.
treated with abuse just now.
Come on, Teddy. Have a seat. Have a seat. I'll let them know you're ready.
And before I'm done talking to you, my last words to you should be, besides thank you, how dare you?
Have a seat, Teddy.
She told me, quote, I feel you're hearing better than the results that you're giving to me. So now I'm going out to smoke and coming back up and seeing the doctor and telling him about this shit. That woman just made me so nervous my armpits are wet now. And I'm gonna be goddamned if I'm gonna sit there pushing somebody's motherfucking buttons, letting them fucking abuse me. Bullshit. I'm standing out here outside this clinic having a goddamn motherfucking panic attack. I had a problem with the nurse.
What's that?
I had a problem with the nurse.
Why?
I'd like to talk to the doctor about it, I guess. She treated me abusively through the exam. She attempted to treat me with abuse.
Did something what?
She attempted to treat me with abuse.
What
She
nurse?
told me, or the doctor or whoever just did my test, told me through the earphones, after we did the clicking for the tones, and then the word recognition portion of the test, after the word recognition portion of the test, she told me, quote, through the headphones, she said, I feel your hearing is better than the results that you're giving to me. So now I'm having a panic attack.
Okay, just calm down.
I'm doing very well. I
Yeah.
went outside and smoked and had a
Okay.
pleasant encounter in the elevator. I'm calm now.
Okay, good. Okay.
I
Well,
don't,
Dr.
I don't
Tillman.
think that's appropriate to be saying to your patients.
Mm-hmm.
Yeah, no. Like, you're trying to fake something. You're trying to get over on us. You're lying to us. I don't appreciate that. No.
No,
I didn't come
understand.
here to lie to anyone.
Mm-hmm. So what are you having? Hearing issues?
Yeah.
Feel like you're having some hearing loss? Yeah.
Yeah. It's like 80% in my left ear and 50 to 80% in my right ear.
Did it happen suddenly, or do you feel like it was
Since
gradual?
February, it was kind of sudden onset.
Mm-hmm.
I had long COVID. You know what that is? Where your flu-like symptoms go away and then you start having everything that is wrong with you
Yes,
flares
right.
up.
Mm-hmm.
Yeah, but I believe it's mainly to do with sewer gas entering the home, namely the hydrogen sulfide in the sewer gas, messing with the cilia in there. I think that might be what it is, although it might be a eustachian tube drainage problem.
We'll
I
let
can-
him decide that,
I
because
can
I don't
actu-
know.
I can definitely say that it's likely due to the sewer gas exposure over a year.
Okay.
That's why I'm here. I'm having it documented. I got no
Okay.
reason to fake anything. Even 30% loss is enough for me. I don't care. Yeah.
So, are
But
you
now
having?
I'm very shaky and nervous because of the way I was shaking.
Yeah, don't just calm down. Everything's
It's,
fine.
I tell myself don't think about it, but it's there.
So, are you having any ear pain today?
Not today. Sometimes there's pressure-related pain. Not severe. One, I'll
Mm-hmm.
call it. Just you
Okay.
feel the pressure.
So let's say yes and pressure, even if it's one. We'll just say,
Mhm.
is it both ears that you feel the pressure in, or one
Yeah.
both?
Excuse me.
And you say that's been going on since February, the pressure?
I've had this before about 2 years ago. My hearing loss.
Mm-hmm.
Um, it didn't really recover, very slightly, but it was slight to begin with.
Okay. Now,
It was
you're.
also to do with feces in the home.
Oh no.
Sewer gas and feces in the home. Feces in the ceiling, in the closet in between the bedrooms, coming down the walls and through the ceiling actually too. At one point, that was 2 houses ago. That was 2 years ago. Now we're dealing with a similar problem of sewer slime on the side of our bathtub, and no, it's wrong. It's a brown film all over our bathroom. It gags me on the sofa and makes me vomit. It's messing with my skin. I'm getting dermal ulcers. I already went to the dermatologist here for it.
Okay, let's went to dermatology. They can give you something.
Yeah. So at one point I was calling 911 because I was puking from the sewer gas, and there's nothing they could really do. The best thing I could do is go for an injunctive relief against my landlord. And I guess this is kind of part of that. I'm suing my landlord for damaging me, and this is part of that too.
Do you smoke every day?
I
Some
vape
days?
lightly.
But you don't smoke
No,
cigarettes,
not
just
at all.
vape?
Yeah. 2 years off of cigarettes.
Okay.
And I don't commonly get ear infections. And the nurse, or I don't know if she's a nurse. I keep saying nurse because you see the nurse before the doctor.
She's a doctor of audiology,
Okay.
probably.
She told me the doctor wouldn't be able to diagnose me unless we did that portion of the test again. I feel that's unfair to me after I did the test already, and she's telling me I got to do that portion again at her discretion, whereas she stated that she feels my
Well, don't
hearing
worry
is
about that.
better
At least let him check
than the
to see if
results.
he sees anything wrong, just by looking. Let's go from there, okay?
Because I would consider that a form of abuse to make me do that and then make me do it again, saying that we can't. No, I don't. I'm calm down about it. I really.
Are you allergic to anything?
Just
Honey?
mosquitoes. I'm sure you probably already have it in your system, which is weird that I even bring it up. But yeah.
Okay. And let's see here. And which pharmacy do you deal with?
Don't. The last pharmacy is Metro, but just leave it open, I guess. That's what
Just a
usually
paper
do.
one?
Yeah.
If
just
he would
paper.
give you
Yeah,
something.
just take
Or there is a
whatever.
pharmacy on the second floor here.
Mhm.
Do you want to use that one or just a paper?
Sure, for whatever. I'll use the pharmacy here.
Okay,
If we need
we'll
to.
put this pharmacy. And if
Oh,
you change your mind, I don't even know if he's going to give you a prescription, but if you change your mind.
Okay. In February, I did go to the ENT or the ER,
Mhm.
Metro. They told me they see a lot of wax and there was some blood on this side. They noticed some blood and some, what's the word? Irritation, redness inside there in the right ear. And they gave me ceramide peroxide drops, which I used the full bottle of and then
Okay.
replaced.
That's
I've
good.
refilled with regular peroxide, which I can't be too bad off.
Mhm.
But I filled that twice since then. So
Okay.
3 bottles total since February.
Just flushing out your ear?
Yeah,
Okay, that's okay.
5 drops and leave it for 5 minutes.
Are you on any medications right now?
No.
Nothing?
No.
Okay, just the earwax removal drops.
Yeah, which was actually
Now we have-
expired slash discontinued since the
Yeah,
first bottle
right.
nobody fills.
Yeah, just the
Technically, it's
peroxide.
just a 1 bottle.
And the Kenalog ointment is that what the dermatologist gave you?
What?
The Kenalog, did she give you that for you?
I think she might have, the dermatologist might
Yeah,
have, but
he
I
said
didn't.
she gave you something.
I didn't because it's not severe when starts to get worse.
Yeah, so just use it as needed.
Hydrocortisone, yeah.
Okay, that's fine.
When it's very minimal, I'm not that worried about it.
Okay. And your date of birth is, Teddy? Okay, you got a birthday coming up soon. Happy birthday. Okay. He should be with you in a few. Like I say,
Make
we'll
sure you
see
get
what
the
he can
note
do.
over
Okay.
about the previous doctor and the
Yeah.
abuse thing. Yeah. Better you tell him than me. It's easier. Okay. Thank you. Okay. So before I went and had my cigarette, I talked to one of the guys downstairs, one of the guys that work here. We'll just say I talked to the security, but it wasn't. Might as well have been. They said I can go ahead and get a hold of the ombudsman down there and report the issue. I just might. I probably won't. It just goes to show I can't walk out my fucking door without bullshit all around me. It's the truth. It wasn't that lady's place to treat me abusively and say the shit that she said out of her fucking mouth through the headphones. It was not her place. She had no fucking right, nor reason. It was in total fucking disrespect, and she could have went with the results that she already had. She could have taken the easy way out and not have been a dick about it. About something I wasn't even fucking doing. So from now on, when someone thinks they're gonna call me out on what they think is my bullshit, just because that's their goddamn opinion that it is, I'll call them out on their bullshit. Hell, I might even go as far as to tell them it's all bullshit. Deal with it.
Hello.
Hello.
Are you Teddy?
Yeah.
All right, I'm Dr. Timmons. What can I do for you today?
I'm having some substantial to profound hearing loss.
Really?
It's about February, which I've had before, not so bad. About
So-
2 years ago. But February, I had long COVID. That's when the flu-like symptoms go away and everything that's wrong with you starts flaring up. It was up to about 80% loss in my left ear and about 50 to 60% loss in my right ear.
It was. How's it now?
It's still 75 to 80 in the left ear and about 50 in the right.
So it's about 20% down on the left.
20% plus.
Down.
80% down.
80% down. Okay.
60 to 80, we'll call it that, about that.
Okay, are you having pain in your ears?
We'll call it 1 from the pressure.
Are you
Sometimes.
having ringing in your ears?
No.
Okay. Have you ever had any major head trauma? Loss of consciousness from
No.
any kind of accident or trauma to your head?
No.
Do you have any family history of hearing loss?
No.
No family history.
I'll cover. I believe it's to do with our sewer gas. I've been exposed to
Now
for
let's take
about
it
a
off the
year.
table. Forget about it. I won't listen to the bad because it's impossible.
That's impossible.
Impossible.
That sewer gas would damage the cilia in your ear.
Okay.
The-
Let me state it again.
the-
Let me state it again.
Okay.
We're not going to discuss it.
But it's impossible that hydrogen sulfide would damage the cilia in your ear.
Yeah, if you injected it through your eardrum with a needle into the inner ear.
Gas exposure can't
Nope.
cause that.
Nope.
Then why did
No.
Google tell me that? I'm not trying to argue with that.
Let's-
It is an argument. But
Google.
I'm being a
Google
professional.
is not
Not a medical professional.
Not a medical professional.
Right.
It's like YouTube
Okay.
or whatever other nonsense there is on the internet. Let's go on.
Can sewer particulates cause deafness?
No.
Not at all. Never.
Nope.
Not a possibility.
Unless you're ingesting it and drinking it.
Can it cause infections in your ear leading to deafness?
No.
Even if there's a thick, slimy build in your shower, it cannot
In your
cause
shower?
Yes.
No.
It's disgusting.
No.
It's awful.
Let's take a look in your ear and see.
Okay.
Because of the only way.
Now the other
excuse
side
me.
that, sorry.
Excuse me.
I was still talking too.
That's okay, but I want
We're
to.
professionals. Go ahead.
Let's go on, and we can.
It
we
makes me
can
vomit on my sofa.
that does not contribute to anything. That adds nothing to my consideration of what's going on with regard to your hearing loss. So I'm asking you questions that do contribute to considerations that are affecting the ear. I'm asking you, do you have a family history of hearing loss? Do you have a family history of hearing loss?
I think you already asked me
Do you have a history of hearing loss?
that. I said I think you already asked me that.
Okay. Next, have you ever had any toxic medications that were like
I'm
chemotherapy?
not with you right now. I'm sorry, sir.
Okay.
I just had
They tried to do a hearing test on you.
a panic attack in the lobby.
Okay. Well, I can
I'm
understand.
recovering from that. I'm not all the way
from
with it.
from panic from.
From the abuse your previous doctor just subjected me to by telling me through the headphones. She told me, quote, "I feel your hearing is better than the results you're giving me."
So they're inconsistent.
She's telling me I'm feigning my deafness. I'm being abused. I feel I'm being treated abusively.
We can work around that because there are.
I feel you were a little too stern with me too.
Because
Those are my feelings. I let them out. That's the way it
That's
is.
fine.
Okay?
I'm trying to get
Very professional.
I'm trying to get to the bottom of things that do affect hearing that we can address, and sewer gas is not one of them.
Okay, there was solid waste heavily in the ceiling of the closet in between the 2 bedrooms 2 years ago, and it made me deaf. I know it was that made me deaf.
Okay.
It made me sick like COVID and made me deaf.
Okay.
It was feces that made me sick and deaf.
Okay.
I'm
I
stern
need-
on that from 2 years ago. Now this could be a different story. I'm hearing how we're still on page.
Okay. So what I want to do is know if you have other medical problems. Any medical problems? And are you taking what medications are you taking for any
I don't have
problems?
any medication.
You don't take any medications
No,
whatsoever.
no.
Okay. All right. Let's go on. So now, what else do you think I need to know? Because I have the things I need to know that are appropriate to ask for hearing loss. You can tell me other things. They may or may not make any
I'm going
difference.
to apologize. Yeah, I'm very nervous right now.
Okay. You can apologize.
Good.
So that-
Smooth things there.
All right, let's go on. So you tell me what other things you think may be an issue regarding hearing loss.
I don't know what you mean.
Okay.
I don't know exactly what you mean.
Okay, what other things do you think may be a contributing factor? How's that make that a little more, more broad?
It's between, in my personal opinion, it's between the sewage issue
Yes.
and the contraction of the COVID.
Okay.
So it could be both contributing factors, in my opinion. Now, that's not your opinion. In your
the
opinion,
COVID
sewer
can be,
gas
the
is
COVID
nothing.
can, the COVID can, yes.
Yeah.
So the next thing about COVID is that that may or may not be true. And the reason I say that, I didn't say it couldn't happen. I'm just saying, let me show you because you seem to be a pretty bright guy. I'll demonstrate. I'll write it down. Let me get a pen. I'll be right back.
Okay. Oh, there's no way in hell that a toxic gas could cause damage to you.
Do you have a history of panic attacks in the past?
Not necessarily, no.
Okay.
Just when I feel I'm being abused,
Do you have a history of being abused of some sort?
Yes.
How so?
Every time I go out the house, sir.
Pardon me?
Every time I go out of my house, sir.
Okay.
It's not a me thing.
All right. Here's the story about.
I have autism, so I notice things. But
Okay, that's the issue.
it maybe goes. No, that's not an issue.
No, no,
noticing things.
It's an issue for panic attacks.
Well, no, the issue for panic attacks is the treatment you receive from others.
All right.
It's,
So here's a story.
In my case.
Can I look at? Can you look at this here?
Hold on.
Here's years.
Mhm.
Here's rate of sudden hearing loss in the population.
Okay.
Okay. Here's 1980. Here's 2000 to 2005, which was the height of COVID.
Okay.
So the rate per 100,000 of people with sudden hearing loss was unchanged through those years. So that means there is a natural rate of sudden hearing loss related to viral infections, and that rate did not change with COVID.
So you're in other words, that says for itself one of the main things that affects his hearing.
No, it doesn't.
In a way.
It says the
Or
rate.
it does affect the hearing.
It can, but it didn't change the number per 100,000 enough
Until-
to to make a difference. So you have viruses, let's call them A, B, C, and D, and you added A, B, C, D, and E here. It didn't change the rate.
Oh, you say it did. You're saying the opposite of what I understood.
Yes.
So it was negligible.
negligible. Have a seat here.
So COVID, according to that, is more unlikely on COVID, just because of COVID.
It wasn't specifically COVID. It could be COVID, but there's so many other causes of hearing loss related to viruses that occur spontaneously in the population anyway. It didn't make any substantial difference. So it's hard to prove that. That's all.
So it's not true what Google says that the hydrogen sulfide can damage the cilia.
It can, but you have to get it in there, and inhaling it won't do that. And if it did, there's no medicine that fixes it anyway. All right. So the question is, do you need a hearing aid? That's the question. All right. So the ear canal is clear, and the eardrum is clear. The reason that's important is because if you had a hole in your eardrum, and if you had infection consumed to the degree that it got in the ear canal, then we might make a case for inner ear damage. But since the ear canal looks totally healthy, and there is no hole, then that can't be. Okay? So we eliminate another question. Let's look in your nose. You may have some chronic difficulty with nose blockage from time to time, and that is there's a clear anatomy issue, and that's your septum, the cartilage and bone that separates the cartilage and bone that separates the one side from the other, blocks a good part of your nose. So if you compare your nose to a car, you run on 4 or 5 cylinders, not 6. Got it? Okay, open your mouth. Good. Let's continue. So what we need to do is somehow get you in a condition where you can work with our audiologist and identify the severity of your hearing loss. That's consistent. That means the audiologist may think you're feigning something. That may or may not be true. I won't even
That
take
was
it.
highly unprofessional for her to say.
I am not going to judge you or her. Okay, I wasn't there. All right.
So you know about it.
Okay.
Yeah. You're not the ombudsman.
Okay. So I'm not going to judge you or her. I can only judge what I can see, and there's no outer ear. Hold on. There's no outer ear problem. There's no drum problem. There's no middle ear problem. Off the table. You may have or may not have inner ear difficulty, and we have to get better information because I don't have enough puzzle pieces. You got it? It's a puzzle, and I don't have enough pieces to answer that question. So we can reschedule with the audiologist, a different one, and then they can decide if 2 people have trouble identifying a consistent hearing pattern. Then you have to decide whether you want to take a next level. The next level after that is what's called electronic testing. In other words, there's testing that's called auditory brainstem testing that you don't answer because they can put like a cardiogram or brainwave. They can identify whether you're hearing or not by electronic tests. So it takes the question of whether you're feigning or confused or the testing is difficulty out of the picture.
So will there be a diagnosis or no diagnosis?
Today?
Yeah.
No
Can't
diagnosis.
come out with that. Okay, can I have the test results?
Let me see.
The tones
Let
and
me
word
see.
recognition.
Let me see if they're out. See if you put them in the file yet.
She said she was going to make me do the tones portion of the test again
Okay.
because she felt I was feigning, in short.
Okay. Again, I'm not judging
trying
you
to
or
get
her.
back down to it. I'm just trying to facts. Yeah.
Yeah. Okay. Well,
We'll
we'll
put the
work
facts
on
and leave them. And I don't judge people. I don't hold a grudge against anybody. I judge what they do and hold what they do against
All right.
them.
Let's
Yeah.
get this here. Hearing in process.
And also I mentioned because of my autism, it has to come out. It's only right that it comes out. That I say things that bothers me.
Yeah, sure. I
Like,
understand.
when you turned my head abruptly for me, you could have told me to turn my head. You didn't have to turn it so abruptly too. It's just
It's your autism.
Yeah.
Okay, well,
I'm not holding nothing.
all right, so here's the
the
story. I can see where the issue was. And the issue is that your ability to talk to me, okay? Hold on.
focused.
I don't care if you're focused or not focused.
And I have one good ear.
The fact that you can talk to me at the level that we're talking is inconsistent with the pure tones. In other words, you're hearing me as we speak better than the pure tones testing would indicate you're capable of. That's where the confusion is, right?
All right.
So that's the problem.
So
So
I push the button when I hear shit. I'm not trying to fight.
so let's schedule a different day
Okay.
and see if that can be retested, say in 3 or 4 weeks, where everybody calms
But
down a
why?
little bit.
I don't understand why you're retesting me. I feel that is abusive to me.
Okay, I understand, but I don't have enough
It's
information
like
to
still
go
calling
forward.
me a liar. In a way, lying about what you hear is why would I
Okay,
even bother?
what would you like me to do? You tell me what
Just
you would
call it a day.
Okay.
Give me the paperwork you can.
Okay.
Call it a day. Yeah.
All right,
Yeah.
because I can't take it any further. You have
Yeah, you can't take it anymore.
No, I said any further.
We're good, bro.
I didn't say that. I said I can't take it any further
I
because I
know
don't
I
have
made
enough
that up in my
information.
own head. I'm
Yeah,
trying to,
well, you have a lot
I'm trying to
going
break
on.
the ice. Right.
Right.
Yeah, okay. Trying to, leave it on a good note.
All right.
Good
So
conversation.
the fact is, if you had hearing loss from COVID, which you may, and if you had, or if you had it from sewer gas, which you may, I'm not
Or
saying.
it could be a contributing factor. That's what.
Okay.
it was.
So there's no medicine for that.
Okay.
Because
Well, documentation is what I'm here for.
okay, so we have this, and
It doesn't matter how this goes. I'm still worried about it. I'm over worried.
okay, well that I can help you with.
You're not the doctor
All right,
for that.
but there's nothing. This hearing loss.
It's getting over my anxiety, my silly mind.
I can see.
All right.
Come on out.
Thank you
Let me-
very
Let me
much.
have you on it.
Thanks for
let me
dealing
print
with
that out.
me. Thanks for being able to do it.
Could you just print out the pure tone result? The audiological.
Yeah, I'll be good down there.
Right. She'll print it for you, and then you decide what you want to do.
It's a good day anyway.
If you get back to me and you want to go forward with reassessing and moving forward to try to fine tune whether you need hearing or not, hearing aid or not, then send me my chart.
I listen even if I don't hear.
Thank you. That few people do that. Very few.
All right. It was a good day after all. Right. Of course.
Okay. So this is your hearing test right here in front, and then in the back is your after visit summary from the doctor. You're welcome.
I wish you a blessed day.
Have a nice day.
Take care.
So I'm out here waiting for my ride back, and it dawned on me. It dawned on me. It didn't dawn on me. It dawned on me. Or is it dawn? I don't even fucking know half the time. It just dawned on me. All I needed was those motherfucking test results. I might as well have reached out with my hand and said, "Give me that shit, bitch." So I get home, and I say to Google that the ENT doctor said it would be impossible that sewer gas would cause any hearing loss. And the shit states directly, quote, "It can cause eustachian tube dysfunction, motherfucker." Call me a liar again. There's your fucking test results that really don't say shit. That cocksucker, no, that sick son of a bitch, doctor. The words that came out of his mouth were appalling. That motherfucker said to me, for the sewer gas or shit particulates to be affecting my hearing, I would have to eat the shit. That's what he fucking said. He's a liar. And now I'm pissed off just in time for my job interview. Let's see me not get it.